Hi, everybody. It's Jessica DeMassa with WTF Health. What's the future health? We are talking to the who's who of health innovation in order to find out about how technology is shaping the future of the care delivery system and the way that we as consumers get care. So joining me today, we are talking to not one, but two big thinkers when it comes to digital mental health. So please welcome from Ginger, we have their CEO, Russell Glass, and we have co-founder and chief operating officer, Karan Singh. Welcome, guys. It's a pleasure to have you with me.
Thanks, Jess. Always great to be here.
Great. Well, Russ, I've talked to you so many times during this pandemic, but this time we have a friend. So we're going to see if the story checks out. And the story I want to talk about is this $50 million Series D round that you guys just raised at the beginning of August. This brings your total up to 120. Lots of big names in this round. Advanced Venture Partners, I think, led it. Bessemer was in there. Cigna was in there. KP. So I guess let's jump in right there. This is a point in time where you are seeing unprecedented utilization. Revenue tripled this past year for you guys, I understand. 200 plus employer clients. Russ, let's start out with you. Let's talk about this fundraise. What does this new money mean for the business?
Well, we had just raised late last year in September. We raised 35 million in September of 19. And so the plan wasn't to raise money this year, but the pandemic has changed things. The world was a place where there was this huge supply demand imbalance prior to COVID. COVID hits and we've seen just the need accelerate, the adoption curve accelerate. And we recognized that there was an opportunity to grow faster. There was an opportunity to reduce some uncertainty by having a stronger balance sheet. And so I reached out to about a dozen firms that I know well and we thought highly of. And fortunately, they agreed that it made sense to put more money in Ginger so that we can help more people get access to care faster and accelerate our vision of a world where mental health is never an obstacle.
Karan, you want to add anything to that?
I think it was a great summary.
I said it all, right?
Why? No, exactly. And you usually do, Russ. You usually do. So, no, I'd say mental health and virtual care are clearly having their moment. I think to underscore the stress and anxiety across this country was, at unprecedented levels prior to COVID, and we've just continued to see that really ramp both in the utilization of our coaching services as well as our clinical services. And so really being there for as many people as we can right now feels extra special, and having the capital on hand to be able to invest in during this time, period of uncertainty, feels really important.
Yeah, I think that, we just saw, there's been so much money in this digital mental health space. And I'd love to get both of you to kind of weigh in on that at this point here, if you can. So, I know the number I had for all of last year was kind of like a range. It was like 750 million, 900 million, depending on what source you took. One of them was What If Ventures, which just tracks digital mental health fundraising. The other was CB Insights. I think that was the more optimistic 900 million number. So for all of last year, and then in Q1 of this year alone, we were right at the $500 million mark in Q1. And we've seen some huge raises. The most recent one, most notably, Lyra Health's $110 million raise. Their valuation is 1.1 billion. What is going on in this space, guys? Is this going to keep, and they had just turned around. Russ, you alluded to the funds you raised at the end of last year. Lyra had just raised 75 million, I think, not even 6 months before this next big round. So talk to me about what you're seeing in this space. It's getting awfully frothy, isn't it?
Obviously, those are big numbers, but I would start with, we're playing catch up to some extent, right? The investment in mental health, we're finally recognizing as an industry how important it is to the overall health of our society and to individuals in the society. And the investment has been so small relative to the need for so long that some of this is just recognition and catch up. So, I think on the positive side of that, we are starting to see that people are recognizing you can't have health without mental health. So many things, so many conditions are comorbid with mental health issues. There are so many people out there that have a need for mental health care that aren't getting it. About 60% of diagnosed are not getting access to mental health care today. 50% of the counties in the US have 0 mental health providers within county lines. So these are staggering deficiencies. And I think we're starting to see investment to help us catch up to those huge needs.
Are those big numbers in not getting care? Is that really, how much of that is the supply part and how much of that is demand? And demand in the sense of, it's like we often hear people with mental health issues are reluctant to seek out care sometimes, whether it be for stigma or they don't know where to go or they don't think they need it. I mean, unpack that a little bit for me, please.
If I understand the question, if you look at raw numbers, there are about 300 million people in the world that have a diagnosed mental health condition that aren't getting care. And that's about 60% or so of those who are diagnosed. There's another 1 trillion people estimated by the World Health Organization that don't have a diagnosis,
Okay.
but have a mental health care need. So yeah, I mean, these numbers are just absolutely staggering. And we've seen things happen like mental health parity laws, where the government stepped in and said, okay, there's a recognition that we need more mental health care. And so insurance companies now have to provide parity. But the truth is, there aren't enough providers by a huge factor to be able to actually deliver on that. And we're not going to solve this problem with more providers. So we have to be innovative. We have to use technology. We have to use new delivery mechanisms, new approaches. And, Ginger has looked at it and said, okay, how do we combine evidence-based care, collaborative care models, chat-based care, video-based care, technology that surrounds it in order to be far more efficient than the current system today? And that's where we are today. And we plan on continuing to invest to create more efficiency over time.
I want to hear a little bit more about that, but before we move off of this subject, I'd like to hear about the clinical validation side of this. So just recently, I read an article about Calm in particular. This has been rolled out to through a lot of big companies to some massive employee population groups. And it's kind of filling a role like, others in this space, some of these other meditation type apps, where it's like a softer mental health, it's serving a softer mental health role than maybe more of a clinical role. And there's a question about the validity of that in this space. I mean, Karan, can you weigh in on some of that for me? Maybe like talk a little bit about the clinical validation and how important it is in mental health and how some of these other solutions, I mean, for meditation or for mindfulness or for, just exercising a more of a well-being approach to mental health. Some of these are great, but where does that line get drawn between that and actually serving a clinical purpose? And how important is clinical validation in that?
Yeah, it's a great question. It's an important trend. As Russ was just describing, the demand side of this equation is growing, and it's also a definition question, which is it's more than the 1 in 5 who might be diagnosed. It's the broader set of people who might just have life, stress, workplace relationship issues. And I think a number of these solutions are starting to step in to fill in that gap of a preventative, more proactive layer of care. But the same level of validation needs to be applied to that cohort, no doubt. I think our philosophy on this has been, if we can build a system that is measuring every interaction, that's actually tracking the responses for every individual, whether they're actually seeing a clinician, a therapist, or psychiatrist, a coach, or engaging with content, then we can actually start to develop a level of evidence that might be required to demonstrate the efficacy. So there is a pretty long tail of apps, if you will, of kind of specific solution or point solutions that are filling in some of that need. Our philosophy here is that most of those have historically just never been measured, and they've never been measured very well. And what we're able to do now, particularly because we have an end-to-end system, is actually track that and publish those outcomes. So we're doing a lot of work to actually publish a lot of the research that was the foundation for Ginger in the early days and continues to be how we've structured our system over time. But I would say that overall, I think that they're really important because they're bringing mental health out of the shadows. They're encouraging people to actually seek access to care, which frankly has been the biggest issue, is the stigma and the activation energy to take that first step is incredibly hard, and they're insufficient. They need more than just a meditation or mindfulness program. I think those are incredibly valuable and important interventions, but they're part of a broader suite, a part of a broader offering for mental health.
So you mentioned the early tech beginnings of Ginger, and you guys it's notable in the industry for the pivot that you took from the tech beginning that you had. But I do have a question about that. So, I mean, what my understanding, about Ginger in the early days was you could put it on your phone and using, following somebody along and tracking the behavior of their phone, you were able to kind of, by looking at text messages or phone calls or even like abrupt changes in location, if any of the usual patterns took a weird turn, it might be indicative of a mental health issue. So say a little bit, I guess, about that technology that you guys started with. We know, I mean, I think it's pretty well known about why you pivoted into the model that you're in now, but is there any chance that tech could be brought back? I mean, any chance on integrating it back into what you have now?
You want to start with the history, Karan, and I'll talk about the product roadmap?
Yeah, absolutely. So, the core thesis of the original hypothesis was that there is no blood test for depression. There's no easy way to measure stress, and we don't have great objective measures for delivering proactive and preventative care. And so that core hypothesis still is true. The set of data that we use to really flag members who might need some kind of proactive or preventative support has really evolved over time. And what we historically had done has evolved into now looking at information around the chat conversations that we're having with our members, the medical records that we're capturing about those members, the ways in which they're engaging with the mobile application, that ultimately give us a better picture, better context about that individual, so we can deliver more personalized care. So Russ can speak a little bit about what's ahead on the product.
Yeah, tell me what's on the roadmap here. You got $50 million to burn, my friend.
Yeah, exactly. Well, I think part of the transition, like the reason the company made that pivot was it recognized that knowing how somebody's doing is important, but it's not the burning need. The burning need is getting them access to care. And so that's what drove Ginger to actually start providing direct care, using some of the technologies that we had built over the years. And as I mentioned, like if you think about where we're going with this, right? We've created a system today that we estimate is delivering anywhere between 3 and 4 times more care per provider than the standard care methodologies today, than the standard industry can do today. We want to continue to innovate down that path. And it's going to be important that we have signal information that comes into us, whether it be the PHQ and GADS, the standard of care today, whether it be understanding how somebody's doing from a resilience standpoint, whether it be understanding how they're doing from a sleep standpoint, from any other myriad of signals, so that we can personalize care and make sure that the care we're providing is as efficient as possible, is as personalized as possible, so that we can get that person healthy as fast as possible and move on to the next person who needs care. And that will continue to be where we innovate. So this $50 million, back to that point, a large part of it's going to go into R&D and doing things like testing different personalized interventions,
Okay.
improving over time, improving the experience that members have, the amount of care we can deliver, the efficiency of care. And we're going to continue to march down that path.
Okay. This is such a crowded space. I mean, there's a lot of small companies that could be acquired and brought into the fold. There's a lot of big companies that can do acquiring, and you guys, I feel like have been mentioned in a lot of conversations both ways. Any plans, anything that we need to know about how you're looking at the future of your business?
We're certainly going to be acquisitive. We've bought the assets of 2 companies over the last year and a half or so, with Lantern and Live Better, and have seen great success integrating components of both of them into our platforms. We'll continue to look for opportunities, and I think they'll be there as this industry moves faster and faster. There are going to be companies that are caught kind of subscale and need a platform like ours to be able to accelerate their growth. So we'll be active there on one side. On the other side, Ginger's goal is not to be acquired by somebody. Ginger's goal is not to be a public company. Ginger's goal is to deliver world-class mental health care at scale, and to make the world a place where mental health is never an obstacle. In as much as there's an opportunity that comes down the road that we see that allows us to accelerate that mission and vision and allows us to get there faster and help more people, then certainly we'd look at it. If we think that independence is the way to do it and to continue to execute down our own independent roadmap, then we'll continue down that path.
Good answer, Russ. I like that a lot. So who do you guys consider to be your biggest competitor? Like, I mean, is it Lyra? Is it that some of the, I mean, is it Teladoc with their face-to-face care delivery, or Doctor on Demand? They do something similar, or is it, I mean, you guys have that, but you also have kind of the cognitive behavioral component that we see in some of those other companies that are out there that are either being integrated into, bigger platformed companies that are managing chronic conditions, or they're platforming out themselves and covering different disease areas. So who do you guys see as your biggest competitor in this space right now? I'd like to understand that.
Yeah, I would say in the employer space specifically, which is our largest market today, although we're spending a lot of effort working with health plans.
You're getting pretty popular there, I see.
Yeah. Well, I think, how do we get to more people faster?
We'll come back to that, but tell me who you're competing with.
So in the core employer market, I would say Lyra is the one we come across the most often. Okay. And our two companies, I think, are quite different, and both are providing world-class access to care. And depending on the kinds of things that you're most interested in as a company, that will help you decide, is it Ginger or Lyra that's best for you. But
they're a big difference, in your own words. Karan, don't worry, I'm asking you next.
I would say there are kind of four core differences. One is we have a very deep international presence. So we're delivering care in 30 countries around the world and all 50 states. So enterprises that want to support employees globally tend to choose Ginger. I would say the second is that we're providing 24/7 access to care. So that ability to access care from anywhere in a virtual first environment that has been purpose built for this collaborative care and access at any time of day or night, companies tend to choose Ginger for that. So you see a lot of companies with highly mobile workforces with not a centricity in a headquarters decide to go the Ginger route. I think we also have an efficiency advantage. So there's a price point advantage. So companies that want to make sure that they are thinking about the cost of healthcare will often go the Ginger route. I think conversely, Lyra has an in-person offering and Ginger does not. So companies that want to have somebody on site at headquarters and can provide in-person care, Lyra is going to be a better choice because Ginger isn't playing in the in-person space.
Okay. Karan, would you add anything to that?
He's been on a roll. This is great. Generally
crushing.
Always. Great summary. I think the only thing I'd add, going back to the preventative or proactive layer, which is to say that a big part of our focus and really our reason for being is to be able to catch people early and allow them a level of access that has low friction, low touch, and that is for us coaching. We have all coaches play that really critical role, which we think is a differentiator vis-a-vis Lyra and a number of other people in this space, because we think that's been the missing ingredient. Those sort of clinician or provider extenders that can meet people in a subclinical setting, can start to unpack what might be going on, and can very quickly get them escalated to an additional level of care or graduated back down to a level of care. I think is a big part of how we see our model continuing to scale over time, and why in many ways we think that this is more than just quote unquote telemedicine, but it's really a reinvention of the mental health care delivery system.
Russ, when we spoke earlier in the pandemic, we talked a lot about the imbalance between the supply and demand side for mental health. And since then, like you said, we've seen a lot of funding, which you're labeling as kind of catch-up money to help, restore some balance to that inequity. Do you think we're making headway on it or not?
Oh, certainly.
Yeah.
I look at some of these, I look at the Ginger model, where even today, I mentioned this ability to deliver 3 to 4 times more care per unit of supply. If Ginger was scaled across the entire country, entire world, that would actually be enough of a factor to make sure everybody could be supported. So, we're obviously scaling to that level is a huge, task. But I think that when you look at models like Ginger and others out there, we're going to be able to solve this problem. We need to continue to invest. We need to continue to innovate. We need to continue to use great technologies. And to your point earlier, one of the reasons that Ginger is publishing is not only to prove our own value, but it's also so that the rest of the industry can see what works and they can use that to better innovate on their own platforms and make sure that because our belief is we're not going to solve this by ourselves at the end of the day. But if we can be an accelerant and if we can be a driver of change so that hundreds of companies can come in and solve the problem, that's how you change the world. That's how you change the entire space.
In fact, I keep hearing that what you just said about like, it's not just going to be us alone who's going to do it. And the market is big enough to support it. I keep hearing that from chronic condition management companies who are competing in the same spaces, Livongo and now Livongo Teladoc. And so they keep saying the same thing. Like there are a lot of people out there who need help, and there's a lot of different ways to deliver that help, and they're not going to have a lock on that. Do you think we're going to see some massive game-changing type deal here in the mental health space, akin to a Teladoc Livongo? I mean, I think that took everybody by surprise. Russ, we had you weigh in on what that meant for the industry for us in a different segment. Everybody should check that out. But I'd love to hear from the two of you, kind of to wrap this up. I mean, like this, not only just mental health, but I think digital health, in its entirety as a category, health tech, has seen, unprecedented funding this year. It's seen unprecedented utilization, even telehealth, which has been around for so long. They've seen their numbers just, rise, dip down, but then, kind of come back. And everybody's saying virtual care here to stay, digital first here to stay. So, as far as what you guys see as happening next, and Karan, I'll start with you. What do you think? Is there going to be like some sort of big game-changing, paradigm-shifting merger or acquisition or deal of some sort that'll just kind of land digital mental health into that same place, that same kind of conversation as Teladoc Livongo did for chronic condition management?
Yeah, it's go time. There's no question about it. The last 10 years and the last year, there's just such an incredible kind of phase shift that's happening here that absolutely, I think there's going to be a set of consolidation. There's going to start to be aggregation. There's going to start to be people who are seeing things that are working and working well, and what they really are just missing is the hyperscale. And so you asked earlier about the health plan partnerships and other channel partnerships. Like for us, that's a manifestation of that, right? That's an opportunity to start to see this in the tens of millions of members, versus necessarily with even just a jumbo employer, which could be hundreds of thousands of employees. So I think there's no question. It used to be a question of if, and now it's more of a question of who. And there are going to be different who's depending on who you're serving. So I'm excited about it because I think this is bringing mental health out of the shadows, and it's people who actually control the pocketbooks in the belly of healthcare, not just on the fringes of quote unquote digital health, that are actually starting to change reimbursement models, starting to change the way in which they're actually integrating this into their core delivery system and how they're selling this to their customers. So I'm hopeful. We're clearly biased, and I think there's no question in the next 12 to 18 months, you're going to see some pretty significant changes.
Russ, what do you think? I love hearing that. I love hearing that you guys are here. In particular, I love hearing that you guys are kind of getting this new level of acceptance from plans and employers. Like, I love hearing that it's like, we've met the system where it's at. Thank God, not on the fringes anymore. And Russ, do you agree?
I do. And, I think even just looking historically, this industry has all the hallmarks of pretty significant consolidation to come. And even if you look at it from our supply demand and balance model, even if you look at it from the creating the need to create efficiency, it makes sense. Because if you, let's say, have 100 companies going after the same space, well, every one of those needs to fund a sales team. Every one of those needs to fund a marketing set of efforts. Every one of those needs to fund a lot of what ultimately are redundant resources. And so as an industry grows up, you can provide a lot more care per dollar by bringing some of these together into a single company that has a single sales team, that has a single marketing effort, that has a brand that has a halo effect. So, you know, will it ever get down to one behemoth? Probably not. But I do think you'll see consolidation and a number of large players be leaders in this, you know, over the period next few years.
And tech is going to lead the way, you think, as far as that goes, like looking more at tech solutions than like, I mean,
in my experience, and you know, I'm only 2 years into the healthcare space, but in my experience so far, I think that technology is a necessity, as is care.
yeah.
And so I think it will be a combination of tech-driven, tech-supported care that ultimately wins here.
Awesome. Well, thank you guys so much for stopping by. Congratulations on your $50 million Series D round. It's exciting to hear you guys gaining such traction in the marketplace and hearing some of those numbers. I'm really excited to hear, you know, about your revenue growth, your 200 plus employer clients, all those deals with the health plans, and even just the warm reception you're getting from them. It's exciting that this is where we're at in this conversation, not only about, you know, health tech, but, you know, specifically health tech for mental health, because I feel like, you know, it's kind of like a double whammy in terms of things that people have shied away from talking about in the established healthcare system. So thank you so much for stopping by. Karan Singh, co-founder and chief operating officer at Ginger, and Russ Glass, CEO at Ginger. Thank you so much for being here. Appreciate the point of view, you guys. Thanks.
Thanks as always, Jess.
Thanks, Jess.
Thanks. For those of you who want to check out more interviews with the leading thinkers here in health tech, please head over to my YouTube channel, hit subscribe so that you never miss an episode, or you can sign up for my email newsletter on WTF.health. I'll talk to you guys soon. Thanks so much for joining us.